So get ready. Clear all drawings. Okay. So get ready. Yeah. Now you have to see here. What you are supposed to see here is, now we are going for the first question. Works as a. So we are bothered about this particular question. Melissa Gordon, Grandmaster class, a part of Seven Sentinels group, Grandmaster class. So listening part A, extract 1, Melissa Gordon. So we are dealing with Melissa Gordon case notes. Right. A consultation, a case, a candidate. So now here, now let's look at the first question in this photo. Works as a dash. Who? Melissa Gordon. Now, your task in the OET listening part A, note completion, is to listen for the specific short phrase or word that completes the notes. Here are some professional tips to help you get the correct answer for this type of question. Question number 1. Now, read the prompt carefully first. The prompt says, works as a dash. Number 1. It must be a job title or a role, because A tells you it's a singular countable noun. Now, prediction before audio. So, what do you think? Maybe a nurse, a teacher, a receptionist, or accountant. A is already there. So, you need not write A again. So, it may be nurse, teacher, receptionist, or accountant. Always guess the type of word you expect before listening. Now, listen for paraphrases. The audio might not say works as a dash. Instead, it might say, I am a teacher. I work in administration, means administrator. I'm employed as an engineer. So, engineer. I am in retail. He will not say works as a. Something else style may be there. So, don't wait for the exact words in the question. Be ready for synonyms. Administration is a related word. So, administrator. I teach English. So, teacher. Any other style may be there. So, don't wait for exact word. Okay. Synonyms may also be there. Right. Now, focus on stress and intonation. Usually, the profession is clearly stressed in the audio because it's important. It's stressed. I work as an engineer. Stress will be there. The word will be stressed because it's a profession. That means it will be told, it will be stressed. Stress. Okay. Now, listen for the speaker emphasizing or introducing it. Now, write exactly what you hear. Spelling counts. Don't add extra words. If they say teacher, write teacher, not a teacher, because A is already there here, already printed in the question. If it says a teacher, don't write a teacher, okay, because A is already there. Next, use the correct context. The topic is an obstetric consultation. Obstetrician, okay, you hear an obstetrician. So, obstetrics, consultation. Common patient jobs could be anything, but listen carefully if something typical is there. Don't panic if it is unfamiliar. Just listen for the job word. Now, example of what it may sound like in audio. So, what do you do for work? I am a nurse. So, your answer for number 1 will be nurse. Now, quick strategy checklist. Now, predict the word type. Make notes if you want. Predict the word type. That means profession. Now, listen for synonyms and paraphrases. And catch the stressed word because it's a profession. Stress will be there. I work as a nurse. I work as a teacher. So, some stress will be there. Spell the word correctly. And write only the answer, no extras. If he says a teacher or teacher, just write teacher. A is already there, so no need of writing A. What is needed, that much only you write. Don't write anything extra. Fine, next. Now let's go to the second question. So this is a profession, you know that. So it is a profession or job title. Remember that. Next, has occasional. Now let us see the second one. Melissa Gordon has occasional dash. Melissa Gordon has occasional dash. What does she have? Occasionally. What does she have occasionally? So you have to listen to synonyms also. Occasional means rarely, not always. So occasional is an adjective describing something she has. So you have to understand the gap. Common collocations in medical history. Okay. Occasional what? Occasional pain, occasional headaches, occasional cramps. Okay, second one. We are dealing with the second one now. We are dealing with the second one now. Occasional what? Occasional what? It's an occasional medical condition, maybe. Okay. Medical condition. Medical symptom. You can say symptom. It's a common medical symptom. So you have to think about the symptoms. Has occasional pain, has occasional headaches. So this also will be stressed because it is important. Has occasional cramps, has occasional bleeding, or has occasional contractions, has occasional asthma attacks. So here there may be nouns. Prediction. It will be a noun. It will be a medical symptom or a medical condition. Remember that. So listen for paraphrase. They might not say, I have occasional pain or I have occasional cramps. Okay. Okay. Has occasional cramps. You cannot say has occasional cramps here. You will not listen the same thing here. You may listen something else. Okay. So remember that. Right. Okay. Right. So has occasional what? You have to understand that very clearly here. Okay. Has occasional what? Now he may say like this. I have occasional. Instead of that, he will say, I sometimes get. Or he will say, I occasionally suffer from. I tend to have. Now and then. Now and then. Be ready for these variations. Off and on. I have these things off and on or on and off. Infrequently, not very regularly. Any variation he may tell. Don't think that this will be the only variation. Variation may be anything. Variation may be anything. So you have to understand. That's very, very important. Yeah. So, Robel Rahman, are you able to hear me? Okay, your voice. Okay. Aisha Chaturani, are you able to hear me?
Yes, sir.
Voice is clear, everything is clear.
Yes, sir.
Yeah, if anybody has anything, just message there in the chat box. Okay, right. Now, has occasional. I have sometimes. I sometimes get. I occasionally suffer from. I tend to have now and then, on and off, I get. Like this, something different. Be ready for these variations, these changes, these alterations, modifications. Okay, there may be, he may say any different style. He may say any different style. That's important. Yeah, thank you, Robel. Right, next one. Focus on frequency words. Frequency, occasional, it's frequency. Frequency words. So he may say, use some frequency words. Sometimes, occasionally, now and then, every so often. So these are audio clues to listen for the answer. So occasional, he will not say occasional. He will say something else. Infrequently, not very regularly, irregularly, off and on, or on and off. Sometimes, on several occasions. Like that, he may give any other synonym instead of saying occasional. Anyway, he can say. So be ready for that one. The OET instruction is a word or short phrase. A word or short phrase. Don't change and don't add. Okay? Don't change and don't add. Yeah, exact words you have to use. Note down exact words. Don't change, don't add. Remember that. These are the suggestions. Next one is, for example, if you hear like this in the audio, possibly, okay, do you have any issues I should know about? I occasionally get headaches. I occasionally get headaches. So answer is headaches with S. I occasionally get headaches. Don't remove, don't add, and don't change. Headaches is there, headaches. Don't make it headache. So as it is, you have to write. Next, you have to practice answering like this. Listen for the noun that logically completes, has occasional something. It's a noun. So be strict about spelling. No excuse. The quick strategy for this question 2 is predict a symptom or condition which is a noun. And listen for frequency words. Sometimes, several times, on several occasions, many times, okay, multiple times, okay, irregularly, frequently, infrequently, like this. So you have to check these things. So watch per paraphrase. Write exactly what you hear. That's what is important. So that's done. Now we are moving to the third question. We are moving to the third question now. Is allergic to something. So is allergic to something. Something means noun. Okay. Is allergic to something. Look at question number 3 from the photo here. Is allergic to something. What is that something Melissa Gordon is allergic to? Melissa Gordon is allergic to. So she may be allergic to some medication or something. Allergic to maybe penicillin, maybe allergic to nuts. It will always take a noun or a noun phrase. Noun or a noun phrase. Allergic to penicillin, allergic to nuts, peanuts, allergic to latex, allergic to pollen, allergic to seafood. So it may be allergic to anything here. So you have to think about these options. Next one, allergic to seafood. Now what is the prediction? The answer will be the specific allergen. She is allergic to some allergen, specific allergen, that particular allergen. You cannot imagine. You have to listen and write the exact word, what she's telling. If she says peanuts, write peanuts. If she says nuts, write nuts. Okay? Maybe cat fur, maybe dust mites or dust. Anything it may be. So, listen for paraphrase. The audio might not say I am allergic to. It could say I have an allergy to. I react badly to. I can't have because I'm allergic. I can't have penicillin because I'm allergic. I have a severe reaction to penicillin. So the words may change. What is here, the same thing might not be there. There may be something different. Remember. Next. So be alert for these variations. Now, clues in intonation. So allergies are important medical history. They are important. So they will be stressed. They will be stressed. Okay. And tone may be something different. Intonation may be different. Rising tone or falling tone like that. Okay. So intonation. Now, the patient or doctor may emphasize, means the stress, the allergen in speech. I have a problem with penicillin. Penicillin. So that will be stressed, especially. I have a problem with penicillin. So some stress will be there. Right. Emphasis will be there. Now watch out for examples in the context. In an obstetric consultation, commonly recorded allergies will be medications and antibiotics and foods. For example, you may say, I am allergic to penicillin. So your answer will be penicillin. That's all. Now write exactly what you hear. You have to write a word or short phrase. Don't add allergy or to. Don't add. Already to is there. Okay, already to is there. So penicillin allergy is wrong. Allergy to penicillin, wrong. Penicillin to penicillin. No, to is already there. So don't write anything else there. It's already there in the question. Allergic is already there. So don't write allergy. Sometimes I have penicillin allergy. So don't write again penicillin allergy because allergy is already there. To is also already there. So don't write the words which are already there. Correct format is penicillin, nuts, latex, gloves. Latex gloves. So as they are, you have to write. Now quick strategy for question 3. Predict the allergen, noun, phrase. Noun or phrase. Listen for paraphrase, allergy or reaction. Spot the stressed word. Write only the allergen, no extras. Now practice example, audio. Any allergies I should know about? Yes, I'm allergic to penicillin. So write your answer, penicillin. That's all. Now let's go for question number 4. So allergic to what? Allergic to what? Allergic to some allergen. We call this as allergen. What is the allergen? Peanuts or penicillin? So that's, you have to focus here. Next one. Has a dash diet. Who? Melissa Gordon. Melissa Gordon has a diet. So what type of diet here? Okay. What type of diet? Okay. It's an adjective, a descriptive phrase. It's a descriptive phrase. Diet type or restriction. You can say here it is a diet type. Diet type. What type of diet? Okay. Type of diet, vegetarian diet, non-vegetarian diet, vegan diet, or what type of diet? You have to think about these things. Okay. So understand the gap. Has a dash diet. Understand the gap. The phrase has a dash diet needs an adjective. It needs an adjective or it needs a descriptive phrase. Okay. Now typical answers. Vegetarian, vegan, low salt diet, low salt, gluten free, balanced diet, balanced, restricted diet, restricted, diabetes diet. So diet type or some restriction. Gluten free, that's a restriction. Low salt, that's a restriction. Okay, balanced diet, a restricted diet, whatever it is, you have to write like that. Listen for paraphrases in audio. They might not say, I have a vegetarian diet. They may say like this. It could sound like, I am vegetarian. I don't eat meat. I avoid animal products. I follow a gluten-free diet. He's not saying I have a dash diet. I follow. So anyway, he may speak. So don't think the same words will be there. So the words you have to follow accordingly. Remember, no capitals, Kirti, no capital letters in the middle of the paragraph. So listen for meaning, even if the words are rearranged. Typical stress and intonation. Diet types are usually clearly stated in medical history. Listen for emphasis on food restrictions or choices because they are very important. Write the exact phrase you hear. The test says a word or short phrase. Don't add extra words or change it. Don't add extra words or change it. Now, examples: vegetarian, low fat, gluten free. Now, the correct answers just the vegetarian. So, not a vegetarian diet because a diet is already there in the question. So, just write vegetarian, low salt, like that. Then, context clues in obstetric consultations. Doctors often ask about diet because it affects pregnancy. Okay, it affects pregnancy. Typical answers in these contexts: vegetarian, vegan, restricted, diabetic, like that. Now, quick strategy for this question number 4. Predict the type of diet, adjective, or short phrase. Listen for direct or paraphrased forms. Watch for stressed words. Write only the phrase you hear. Now, practice example audio. For example, it may be like this: do you follow any special diet? Doctor asks. Then Melissa says, yes, I am a vegetarian. Or I eat only vegetables. Then you have to write vegetarian. That's all. So, answer is vegetarian. Remember. Next. Question number 5. So, non-smoker, this will be her second child. Next one is 5th question. Needed dash treatment before first pregnancy. Needed dash treatment before first pregnancy. Needed dash treatment before first pregnancy. Now try to understand this. What type of treatment? And remember, this is obstetrics. Okay, consultation. Okay. So that's very, very important. Now go through this question now. Go through this question. Yeah. Now give your comments. We have done 4 questions so far. Is the explanation useful? So the same technique you can apply everywhere. Okay, is the explanation useful? I'm giving you all the techniques so that you can apply for all the questions. Okay, come on, give your feedback, please. Give your feedback, please. ఎక్కడున్నది Yeah. So this is it. Yeah. All of you just write one sentence, no, whether it is useful or not. Only 4 students are there. One response already came. Hmm. Yeah. Yes, please. So, Kirti Parmar, very good. Robel Rahman, very good. Yeah, Robel, it is for you, specially for you, because, okay, next week you are going for the exam. So, it's specially for you. I'm giving lot of sessions. Okay, if you are ready to stay 6 hours also, I am there for you. Okay, so don't miss. I will be staying long time for you. Yeah. So, but you have problem with your mic. I don't know what to do. Right. So, this is how it goes. Right. This is how it goes. Next, fifth question. Okay. Needed dash treatment. What type of treatment? So, type of treatment here. Needed type of treatment here. Needed type of treatment. So, go there and check. Fifth question. Yeah. Now, let us look at that now. Fifth question. Yeah, you can check from audio or some phone or something else. Okay. So, it's important. Na? See, it's important, very important. You have to check something. Otherwise, take somebody else's phone or do whatever you want. I want to hear your words. I want to hear you. That's all. Okay. Keep this like this one and take another phone and join from there and speak. No problem. You tell, sir, this is me. Unmute. I'll unmute. Okay. Next one. So, need a dash treatment before first pregnancy. What type of treatment here? Now, let us see the question here. See the question here. Question number 5. Excellent. So far, we have done 4 questions. Now, fifth question. Melissa got needed dash treatment before first pregnancy. Needed dash treatment before first pregnancy. Now, understand the gap here. The phrases is needed dash treatment. What is the treatment? It's a type of treatment. It's a treatment type. Treatment type. So, treatment type. Okay, type of treatment. Right? Here, type of diet. Here, type of treatment. Okay. So what is the treatment type? That's very, very important here. Here the type of diet. Here the type of treatment. So that's very important here. Okay. That's very, very important here. So be very careful with these words. What type of treatment is it? So the type of treatment may be, because this is obstetrics department. Okay. It may be fertility treatment before pregnancy, fertility treatment, or it may be hormone treatment, or it may be IVF, okay, IVF treatment, or it may be surgical treatment, or it may be medical treatment. Okay. So the type of medical treatment is here. So you have to predict for that. It may be a noun or a short noun phrase. Now listen per paraphrases. They may not say, I needed fertility treatment. It could be, I had to have fertility treatment. I underwent IVF. I required hormone therapy before I conceived. Like that. Be ready for these variations in the audio. Now, clues in intonation. Clues in intonation. Clues in intonation. Important details in medical history are usually stressed clearly. Important details in medical history are usually stressed clearly, because this is an important detail. What type of treatment is very, very important. So stress will be there. The words will be stressed. Okay. He will not say, IVF treatment. IVF treatment. Oh, fertility treatment. Fertility will be stressed. Remember that. So here for those stressed words, the doctor might repeat or clarify the term. Okay. Now context clues, because it's very important. If the patient doesn't understand, he may repeat or he may even clarify. Now context clues. The question says before first pregnancy. The most common relevant treatments are fertility treatment, maybe, or something else. Now write exactly what you hear. A word or short phrase. Don't add extra words. Now, doctor might say like this, example audio. I'm giving an example audio script. Did you have any help getting pregnant the first time? Did you have any help getting pregnant the first time? Yes. I needed fertility treatment. So the answer is fertility. Another possibility, I needed IVF. IVF is the answer. So quick strategy for question 5. Predict a type of treatment, noun or short phrase. Listen per paraphrases. Needed, underwent, had to have. And focus on stressed words. Focused on stressed words. Write exactly the answer you hear. Write exactly the answer you hear. Practice example audio. Any treatment before your first pregnancy? Yes, I had IVF. So IVF is the answer. Okay. Yeah. Next, sixth question. First baby presented as. Okay. First baby was presented as. Okay. Yeah. So first baby presented as. Okay. First baby presented as. Yeah, first baby presented as. Okay. So understand the gap there. Presented as in obstetrics describes the baby's position or presentation during labor. Okay. Right. So first baby presented as. So type. So understand the gap. Let's focus carefully on this note completion prompt. So first step 1, all of you write down the points. All of you write down the points. Number 1, step 1, understand the gap. Step 1, I'm teaching you the steps now. For every question, what you have to do is this. For every question, what are the 5 steps you have to do? Number 1, steps. So follow the steps. Follow these steps for each question. For each question. Number 1. Number 1. What is understand the gap? Understand the gap. That is the first step. Note down all of you. Very, very important. Understand the gap. Number 2. Listen for paraphrases. Listen for paraphrases. Number 3. context clues. Number 3, context clues. Number 4, write exactly what you hear. Write exactly what you hear. Number 5, listen for stress and intonation. Listen for stress and intonation. Okay. So these are the 5 steps you are supposed to follow. These are the 5 steps which you are supposed to follow. No excuse. Follow these 5 steps and it will be easy for you. Okay, these are the 5 steps. Yeah. So I have mentioned here all of them. Understand the gap. On the left hand side, I have written here. Na? Listen for paraphrases, context clues, write exactly what you hear, listen for stress and intonation. If you follow these things, it will be easy for you. Yeah, next one. So listen for okay. What are the words which you can guess here? So understand the gap. Presented as in obstetrics describes the baby's position or presentation during labor. Now typical answers are breech, cephalic, vertex, face, shoulder. So prediction, a single medical term describing fetal presentation. Now listen for paraphrase. They might not say the baby presented as breech. It could sound like the baby was breech. The baby was in breech position. It was a breech birth. He was head down. That means cephalic vertex. So listen for any way of describing the baby's position. Now context clues. The phrase presented as is medical. The answer will always be a presentation type. So it's a presentation type. As it's a type of presentation. So how he was presented. Okay. How he was presented. Now here, so this is also type. Presentation type. So mostly many things will be types here. Now you understand that these are types. What type of presentation type? Presentation type. Okay. So remember that. Now here, the answer. The phrase may be presented as is medical. Okay. It may be breech. That means bottom or feet first. Okay. Bottom or feet first. Cephalics. That is, or vertex, head first. Shoulder, rear, transverse. So you have to remember all these things and you have to write accordingly. Next, write exactly what you hear. A word or short phrase. Don't add extra words. For example, he was breech. Answer is breech. Audio, he was head down. That means answer is cephalic. Okay. Answer is cephalic. It's a, if that's what they want on the key. Okay. The test always wants the medical term as given in the audio. Whatever is given in the audio, they will give that one only. Okay. Head down, but they will say cephalic if that is needed. So next one, listen for stress and intonation. Presentation terms are important and often clearly spoken in consultations. Quick strategy for this question. Predict a presentation type. Watch for synonyms and phrases. Focus on the stressed word. Write only the exact term you hear. Example, audio practice. Now the doctor will ask you like this. How did your first baby present? Melissa, he was breech. Answer is breech. Okay, fine. So we have gone through 6 points. Okay, we have gone through 6 particular points. Yeah. 1 second. Let me take a photo of this one. Print screen. Full screen. Yeah. Yes. So that's what it is. Now we are moving to the next part. 7th to 12th question. Go through these. Yeah, go through these questions. Okay. Go through these 7 to 12 questions for a minute. Yeah. Yes. Shall we continue? Or are you tired? Shall we continue or are we tired? Tell me. Lot of sessions are there. Yes, sir. Continue. Okay. What about others? What about others? Yeah. Tomorrow new batch is starting. So all the regular students who have registered continue. Okay. Yes. Good. Fine. Now question number 7. Now let us go with question number 7. Okay. Question number 7 is here. Yeah. Here is question number 7. Now let us see. A dash required during intervention. Question number 7. Dash required during intervention. Yeah, please. Yeah, dash required during intervention. Now let us study. Understand the gap. First step is understand the gap. Always, for all these questions, understand the gap. Okay. Now, let us see. Number one is understand the gap. That's first step. Number two is listen for paraphrases. Number three is context clues. Number four is write exactly what you hear. And number five is be ready for stress and emphasis. Yeah. So these are the 5 points which you have to follow. So steps. So follow, or you can say procedure to follow. Okay, procedure to follow. Right. That's it. So follow this particular procedure. Right. So what type of what was required during intervention? So here, if you see very carefully, required during intervention, dash required during intervention. It is looking for what was required. Something was required. So noun, you need a noun here. Okay, you need a noun. Some medical treatment or some medical requirement was there. So some medical requirement, a noun or short phrase describing a medical requirement. So required medical, some medical requirement or some procedure or some type of requirement, some treatment or medical requirement was needed. Okay, some action was needed, we can say. So something was needed, something was needed here, noun, a noun you can say. Okay, noun. So what is that exactly here? Okay, a noun was needed. What type of thing? So it may be pain relief, or it may be anesthetic, or it may be epidural, or it may be monitoring required, monitoring, or it may be assistance required during intervention, assistance or guidance or counseling, something like that, some noun. You have to remember. So next, eighth one. Okay. Yeah. So eighth one. After giving birth, after giving birth, try to understand this point here. Okay. After giving birth, had problems with something. had problems with something post birth, after giving birth. So question number 8. Yeah, sorry, 7th is not complete. Nah? Yeah, 1 second. So now here write exactly, okay. It may be, for example, now search for context clues. The section is about her first pregnancy and birth intervention. What did she require during it? 7th question only. I'm doing continuation. I forgot. I missed something. So what did she require during it? In obstetric consultants, common items are epidural, most common, anesthetic, pain relief, assisted delivery. So like this. So write exactly what you hear. The instructions say a word or short phrase. The instructions say a word or short phrase. Don't add or change anything. Now, epidural, pain relief, anesthetic. These may be the answers. Wrong approach. Writing a sentence or changing the phrase is wrong. Now, be ready for stress and emphasis. Words are about medical needs during birth are often clearly emphasized. So they will be stressed. Emphasis means stress. Quick strategy for question number 7. Predict a treatment or need. Watch for paraphrases. Focus on required or needed or had to have. Write only what you hear. That's what it is. Next, 8th question. After giving birth, had problems with dash. Helped by midwife. Okay. Now, understand the gap here. So, after birth, remember, okay, postpartum issue. It's asking for a postpartum issue. Postpartum. Okay. Postpartum issue. Noun or short phrase. Typical answers in obstetrics are breastfeeding, bleeding, pain, stitches, and anything you want. Now, prediction. A common postnatal problem the midwife would help with. So listen for paraphrases. Listen for paraphrases. So she had problems and she was for that problem she was helped by midwife. So she had problems with breastfeeding. It could sound like she struggled to breastfeed. Feeding was difficult. She found nursing hard. There were issues with breastfeeding. So listen for any way of describing the problem. Now, context clues. Helped by midwife tells us what kind of problem it was. Midwives often help with breastfeeding support, managing pain, emotional support. Most common OET answer for this type of question, breastfeeding. Write exactly what you hear here. The test says a word or short phrase. Don't add extra words or change the form. Examples of valid answers: breastfeeding, bleeding, pain. Be ready for stress and intonation. Potential issues are important and clearly stated in the audio. They are stressed. So quick strategy for question number 8. Predict postpartum problems. Listen for paraphrases: struggled with, found hard. Focus on stressed words. Write only the word or phrase you hear. That's it. So practice example audio. I'm telling you like this now. Doctor may say like this. Any problems after delivery? Melissa, I had a trouble breastfeeding. So breastfeeding is the answer. Now we are moving to question number 9. Baby's father. So we are moving to baby's father. Okay. Now baby's father. Family history of something. Family history of something. Okay. So the phrase is family history of. Family history of something. This is a medical condition. This is a medical condition. Okay. medical condition. This is a medical condition. So listen for the medical condition here. Okay. Listen for the medical condition or health issue. Medical condition or health issue. It may be a noun or a short phrase. So family history of diabetes, hypertension, family history of asthma, heart disease, family history of twins, if it is genetic, mental illness. Okay, a medical or genetic condition, a medical or genetic condition or health issue. Well, listen for paraphrases. They might not say, he has a family history of diabetes. It could sound like, his family has diabetes. There's diabetes in the family. His father is a diabetic. Heart problems run in his family. So like this. So be ready for these variations. Context clues. The section is about baby's father. The doctor is documenting her partner's family health history. Okay. This is a standard in obstetric booking appointments. So common OET style answers will be diabetes, hypertension, asthma, heart disease, mental illness. Now write exactly what you hear. The test says a word or short phrase. Don't add extra words. Now examples of valid answers are diabetes, heart disease, asthma. Now listen for stress and intonation. Family history items are important in prenatal consultations. So usually they are spoken very clearly and very slowly. They will not speak very fast. They will be stressed. Okay, they want you to understand that. Quick strategy for question number 9. Predict medical or genetic conditions. Watch for paraphrases in family context. Focus on stressed words. Write only the word or phrase you hear. Practice example audio. Doctor says, is there anything in the baby's father's family? Melissa, yes, there is diabetes in the family, in his family. So the answer is a diabetes. Now let's move on to the next question. Question number 10. Question number 10. A child from previous marriage has a dash. A child from previous marriage has a dash. Has some medical condition maybe. Has some problem maybe. The child from previous marriage has a dash. Has some problem. What might be the problem? It needs a medical condition or a diagnosis. So it needs a medical condition or a diagnosis. Or medical condition. Okay. Noun or short phrase. Child from previous marriage has asthma, eczema, diabetes, allergies, autism, ADHD, attention deficit hyperactivity disorder. So a health condition or diagnosis is the prediction here. Okay. So step 2, listen for paraphrases. Listen for paraphrases. Now how are you going to listen for paraphrases here? He might not say, they might not say, he has asthma. He has asthma. The child from previous marriage has asthma. They will not say like that. They may say like, he suffers from asthma. He is asthmatic. She was diagnosed with eczema. He is on medication for ADHD. So now they may give in an indirect method. You have to catch the word and you have to write asthma, eczema, or ADHD or whatever. So listen for all ways of describing the condition. That is the tip here. Now let's go for the third point, that is context clues. Context clues. Now here it says child from previous marriage. So it's about Melissa's other child, the first child. So this is going to be the second child. The doctor is noting down any existing health issues in that particular child So he's asking. So typical answers in OET settings might be asthma, eczema, allergies, autism, ADHD. So these are the conditions often asked about in prenatal history. Now, step 4, write exactly what you hear. The test says a word or short phrase. Don't add extra words. Don't add extra words. Now, the examples of valid answers are asthma, autism, eczema. Now, step 5, listen for stress and intonation. Medical conditions in family or other children are carefully confirmed in obstetric consultations. So, usually clearly stated and slowly spoken. Now, quick strategy for question number 10. Predict child health conditions. Watch for paraphrases or synonyms. Focus on stressed words in the audio. Write only the word or phrase you hear. Now let us check a practice example audio. Now the doctor says like this. Any health issue with your other child? Melissa, yeah, he has asthma or he is asthmatic. Then you have to write asthma. Don't write asthmatic. So you have to set how it fits here. Next question. Next question. Yeah, last 2 questions. Excellent. Now let's look at question number 11 from the footer. Inquired about the possibility of dash testing. Understand the gap. The phrase is possibility of dash testing, some type of testing. Okay. The answer will be a type of test, type. So remember, mostly these will be types. Okay. Mostly these will be types. So type of test. So it is type. So we have seen here many types are coming. So type of what? Type of test. Type of testing. What type of testing? Okay. What type of testing? Yeah. Now here, yeah. Typical answer in antenatal consultations. Okay. So genetic, chromosomal, screening. So possibility of dash testing. Okay. Antenatal testing. Maybe prenatal, antenatal, all these things you have to consider. Now here, genetic, chromosomal, screening, carrier, blood, NIPT, non-invasive prenatal testing. Now prediction, types of prenatal testing. Listen for paraphrases. They might not say, I want genetic testing. It could sound like, I'd like to know about genetic testing. I was wondering if I could have genetic tests. I asked about chromosomal testing. I inquired about carrier testing. Is genetic screening available? So be ready for all these types of variations. Now, context clues. The section is points raised. So these are things Melissa specifically asked the doctor about. Points raised. Okay, points raised. Now, genetic testing, very typical. Chromosomal testing, screening tests, NIPT. Most common OET style answer here is genetic. Now, write exactly what you hear. The test says a word or short phrase, so don't add extra words. Example of valid answers: genetic, chromosomal, carrier, NIPT. Listen for emphasis and clarity. Patients asking about tests will often sound hesitant or curious in the audio. The doctor might repeat the term clearly, so there is a stress. Now, quick strategy. Predict types of prenatal testing. Watch for synonyms and paraphrases. Focus on words that complete testing naturally, dash testing naturally. Then write only the word or phrase you hear. Now practice example audio. I'm going to give you one set. Doctor says like this. Was there anything else you wanted to ask about? Melissa says, yes, I wanted to ask about genetic testing. So the answer is genetic. The last question. The last question. Question number 12. provided her with a leaflet of preparing dash for new baby. Providing her with a leaflet on preparing dash for new baby. So new baby, so old baby. So preparing the old baby for new baby. Okay, maybe a leaflet to how to train the old baby or the sibling or the brother or sister or something for the new baby. So welcoming the new baby, right? So the phrase is wants advice about dash after birth, postnatal. So it needs a topic or issue she wants help with, a noun or short phrase. The typical answer in antenatal consultations: feeding, antenatal, okay, before. So feeding, breastfeeding, contraception, sleep, baby care, vaccinations. So prediction, a topic new mothers often ask about. So what are they? Listen for paraphrases. They might not say, I want advice about breastfeeding. It could sound like, I'd like to talk about breastfeeding. Could you give me some guidance on feeding? Okay, like that maybe. Preparing dash for new baby, preparing someone or something. Okay, here about maybe baby care or something like that. So here he's going to ask preparing someone or something. Maybe preparing someone, preparing herself for new baby, or preparing the husband for, preparing the home for new baby, preparing the room for new baby, preparing the house for new baby, preparing already existing baby for the new baby. Anything may be there. So what is that person or thing? You have to understand. Okay. So it may be a sibling because she already has a daughter, already has a child, son. So that you have to understand. Maybe preparing that earlier child, elder girl or boy for this new baby. Okay, because sometimes the elder children may not welcome the younger children. So they like them to have, but they won't welcome them. They will not be ready because they think that the attention of the parents will be lost like that. Maybe because of that reason. So I hope you understand everything. So that's it. So we have done one session successfully. And then we're going to have another session that is after the lunch, after the dinner. Sorry, I'm going for dinner. So we'll have after the dinner. Thank you very much.